Not every surgery is life-saving. In fact, after the age of 70, some procedures can do more harm than good, especially when they're elective. Now, this doesn't mean surgeries are bad or unnecessary. In many cases, they can be life-saving. But the truth is, not every procedure is the right choice for every person, especially later in life. Some of these procedures are performed thousands of times every year, yet many experts now question whether they are always necessary. So why are these surgeries still being recommended? And more importantly, how can you make the safest, most informed decision for yourself or someone you love? In today's video, we'll walk through 6 common surgeries seniors should carefully reconsider. And what safer, evidence-based alternatives may be worth exploring before saying yes. This video is for educational purposes only and is not a substitute for professional medical advice. Number 1. Elective spinal fusion. Before we begin, if you care about your health or the well-being of someone you love, take a moment to subscribe to the channel, like this video, and share it with others who might benefit. It helps us bring more honest, research-based information to people who need it most. Let's start with one of the most commonly recommended procedures for back pain: spinal fusion. On paper, it sounds like a solid solution. 2 or more bones in the spine are permanently joined together to reduce movement and, in theory, reduce pain. Now let me tell you about Peter. He was 72, living just outside Manchester, enjoying his quiet retirement. Like many people his age, he had been dealing with back pain for years. It wasn't unbearable, but it was persistent. Walking became slower, mornings were stiff, and even simple things like gardening started to feel like a challenge. Eventually, Peter went to see a specialist. After scans and consultations, he was told about spinal fusion. The idea sounded reassuring: stabilize the spine, reduce pain, and get back to normal life. And to be fair, in some cases, surgeries like this can be helpful. Healthcare systems such as the NHS and other European providers don't recommend major surgery lightly. These decisions are usually made carefully. But here's what Peter wasn't fully prepared for. At 72, his body didn't heal the way it used to. After the surgery, recovery was slow, much slower than expected. Weeks turned into months. Instead of feeling stronger, he often felt weaker. The stiffness in his back didn't disappear, in fact, it increased. And the pain he hoped would be gone. It was still there, just different. This is something many seniors don't realize. Spinal fusion is a major operation, and after the age of 70, the risks increase. Healing becomes less reliable because bone density is often lower. That means the spine may not fuse properly. There's also a higher risk of complications like infections, blood clots, and reactions to anesthesia, even in well-equipped European hospitals. And then there's mobility. When part of the spine is fused, it no longer moves. In younger individuals, the body often adapts. But in older adults, this can lead to more stiffness and added strain on nearby parts of the spine. Some seniors expect to move more freely after surgery, but instead, they feel more restricted. Perhaps the most important point is this: many cases of back pain in older adults are caused by natural, age-related wear and tear. These changes aren't always something surgery can truly fix. Now, this doesn't mean spinal fusion is always the wrong choice. In certain situations like severe spinal instability, fractures, or significant nerve compression that hasn't improved with other treatments, it can still be appropriate. And outcomes tend to be better in people who are younger or in very good overall health, often under the age of 65. But for someone like Peter, whose pain was moderate and linked to age, decision. Surgery number 2. Carotid surgery. Now let's move to another procedure that often sounds urgent and life-saving: carotid surgery. This surgery is usually done to remove plaque buildup in the arteries of the neck, the vessels that carry blood to the brain. The goal is simple: reduce the risk of stroke. And on the surface, that sounds like the right decision. But here's where many seniors and even families get confused. Let me tell you about Margaret. She was 75, living in a quiet town in southern England. She felt fine overall, no major symptoms, just regular checkups. During one routine scan, doctors found some narrowing in her carotid artery. Suddenly, the conversation changed. Words like stroke risk and preventive surgery started coming up. Naturally, she felt scared. Anyone would. She was advised to consider a procedure to remove the blockage, what's commonly called carotid endarterectomy. Now, to be clear, in certain cases, especially when someone has already had symptoms like a mini-stroke or warning signs, this surgery can be very beneficial. Healthcare systems like the NHS follow strict guidelines when recommending it. But Margaret had no symptoms. And that's where the decision becomes more complicated, especially after the age of 70. You see, many older adults have some degree of narrowing in these arteries. It's a common part of aging. But not every narrowing leads to a stroke. In fact, for seniors without symptoms, the actual benefit of surgery can be quite small. At the same time, the risks of the procedure itself start to matter more. There's a small but real chance of stroke during or shortly after the surgery. There can also be complications like nerve injury, bleeding, or heart strain, especially in older patients with other health conditions. In Margaret's case, after a second opinion and careful discussion, she chose not to rush into surgery. Instead, her doctors focused on managing her condition with medication, monitoring, and lifestyle adjustments. And for many seniors, this approach can be just as effective, sometimes even safer. That's the key point here. Carotid surgery is not unnecessary, but it's not always urgent, and it's not always the best first option, especially for seniors without symptoms. It tends to be more clearly beneficial in people who have already had warning signs like a transient ischemic attack, often called a mini-stroke, or mild stroke symptoms. But for someone who feels fine, the decision should be made very carefully, weighing the real risks against the actual benefit. Margaret still goes for regular checkups. She takes her medication, stays active, and lives her life without the stress of a major surgery. And her story is a reminder. Sometimes, the safest decision is not to rush into the operating room, but to fully understand your options first. If you're finding this video helpful so far, let me know in the comments below. Are you learning something new? Also, don't forget to subscribe to the channel, it really helps us reach more people. And I'd love to know, where are you watching from? Surgery number 3. Knee replacement for mild osteoarthritis. Now let's talk about knee replacement, a surgery many seniors are told could restore mobility and reduce pain. And in severe cases, it absolutely can. But the key issue is timing. Knee replacement is often recommended when osteoarthritis becomes advanced, when pain is constant, mobility is significantly reduced, and daily life is clearly affected. However, for mild osteoarthritis, the situation is very different. In early or moderate stages, the joint still has some natural cushioning, and the pain full freedom of movement, but instead experience ongoing discomfort or limited flexibility. Surgery number 4. Coronary stent placement for stable heart disease. If you care about your heart health or someone close to you, take a moment to like this video and subscribe to the channel. And I'd really like to ask you something. Has a doctor ever recommended a heart procedure to you or a loved one? How did it make you feel? Let me know in the comments below. Now let's talk about coronary stents, a common heart procedure used to open blocked arteries. In emergencies like a heart attack, stents can be life-saving. But in stable heart disease, where symptoms are mild and predictable, the benefit is often limited. Many people believe a stent will prevent future heart attacks, but in stable cases, it may not significantly improve survival. Instead, it mainly helps relieve symptoms like chest pain. At the same time, the risks increase after 70. These include bleeding, complications during the procedure, and the need for long-term blood-thinning medication, which can cause further issues. That's why healthcare systems like the NHS often recommend starting with medication, lifestyle changes, and regular monitoring. Now, this doesn't mean stents are unnecessary. They are very important in emergencies or when symptoms are severe and not controlled. But for stable heart disease, especially after 70, it's not always the first choice. Because the goal is not just to open an artery, but to protect long-term health safely. Surgery number 5. Prostate surgery for mild urinary symptoms. As men age, it's very common for the prostate to enlarge. This condition can cause symptoms like frequent urination, especially at night, a weak urine stream, or difficulty starting. Procedures like TURP are often recommended to relieve these symptoms. And in severe cases, surgery can be very effective. But for mild symptoms, especially after the age of 70, surgery may not always be necessary. Because these symptoms often develop slowly and can be managed without surgery. At the same time, prostate surgery carries risks, particularly in older adults. These can include bleeding, infection, and side effects like loss of bladder control or sexual function. That's why healthcare systems like the NHS usually recommend starting with medications, lifestyle adjustments, and monitoring. Now, this doesn't mean prostate surgery is wrong. For severe symptoms that affect daily life, it can provide real relief. But for mild urinary problems, especially after 70, it's often better to try safer options first. Because sometimes, managing the condition carefully is better than rushing into surgery. Surgery number 6. Aggressive cancer surgery for slow-growing tumors. If this video is helping you see things more clearly, take a moment to like, subscribe, and tell me in the comments, have you or someone close to you ever faced a cancer decision later in life? Now let's talk about something very serious: cancer surgery. But not all cancers behave the same way. Some tumors grow very slowly, especially in older adults. In these cases, aggressive surgery may not always improve life expectancy, particularly after the age of 70. At the same time, major cancer surgeries can be physically demanding. Recovery can be long, complications are more likely, and in some cases, quality of life may decline after the procedure. That's why many European healthcare systems, including the NHS, sometimes recommend a different approach called active surveillance or watchful waiting. This means closely monitoring the cancer without rushing into surgery, especially if it's slow-growing and not causing immediate harm. Now, this doesn't mean surgery is not important. For aggressive or fast-growing cancers, timely surgery can be life-saving. But for slow-growing tumors, especially after 70, the decision should be made very carefully. Because sometimes, the goal is not just to remove the disease, but to preserve comfort, independence, and quality of life. Before you go, I'd really like to hear from you. Which of these surgeries surprised you the most? Was there anything in this video that changed the way you think about treatment decisions after 70? And I'm especially curious, have you or someone in your family ever been advised to go through one of these surgeries? What decision did you make and how did it turn out? Please share your thoughts in the comments. Your experience could genuinely help someone else make a better decision. Also, what would you like me to cover next? Would you like a video on early warning signs seniors should never ignore? Daily habits that protect your heart and brain? Or medications seniors should be careful with? Or is there something else you're worried about? Let me know in the comments. I read every single one. And if you found this video helpful, don't forget to like, subscribe, and share it with someone who might need this information. Because sometimes, the right knowledge at the right time can truly change a life. Take care, and I'll see you in the next video.